Hey everyone! I'm currently in my car right now, as you can see, and I'm actually on my way. Not on my own, I'm driving in the parking lot right now, but I am going to my first emergency room experience, and I'm so excited. This is kind of a last minute thing that got pulled together. I've never been to an ED before. At my school, I never got the opportunity to, unfortunately, which kind of sucks. So, at my internship, I got the opportunity to go to an ED, and I was like, heck yeah, like, of course I want to go. So, yeah, I have a couple minutes, and then I'm gonna head in. It's just for a short shift. It's about 4.5 hours, but it should be a really good opportunity, because I've never, seen one, and I probably won't work in one. It's not really something that I'm like thinking about doing, but I just wanted to be able to see it, just because I've always wanted to see one, and so yeah, I'm really excited, and I will let you guys know how it goes. And it's gonna be really fast paced in there, and it's an evening shift, so I'm sure we'll get a lot of crazy stuff happening. But yeah, I'm really excited. So if any of you are interested in the ED or have been to an ED, let me know what you think, because I've never been to one. So yeah, I'll keep you guys updated. See ya. Okay, so I wanted to let you guys know too, before I came here, I tried to prep a little bit per se on medications I use a lot in the ED. So I tried to look up the cardio meds that people come in with, heart arrhythmias, or amiodarone, or use adenosine or atropine for different heart problems. So I've been trying to try to look some stuff up like that, just so I'm not looking there like a complete I don't know what I'm doing. So that's how I've tried to prep for it. I've asked a lot of people about their experience in there. My preceptor used to work at a ED and told me a little bit about it, and so yeah, I'm just kind of excited to see how it goes. Maybe I'll put in some IVs, who knows? So I'm open for whatever. Okay, now I'm actually gonna go. All right, bye. Okay, so it is the day after I went to the ER, and I want to tell you guys a little bit about my experience, just because when I got out, it was, 11:30 or whatever, and I was exhausted. There was so much, fast pace. At the end, I was just I'm going to bed. You know what I mean? Because it was a lot. So, as a person who has never been to the ER, I knew a bit about it just from, you hear in nursing school and you learn about it a little bit. But I didn't know exactly how it works. So I know, because for those of you who don't know, when you go to an ER, you get triage. So you get basically determined how much of a priority what you're there for. So for example, if you're in a heart attack, you're going to be one of the first people to go in. If you come in with a sore throat, you're going to be kind of in the bottom of the list, because it's not an immediate priority. So I was actually in the ER. So triage will determine what patient you're getting. You get the patient. I think we had about 3 patients throughout the night, and even just the whole area is different than a normal med-surg floor. This is Ruby, by the way. And so even the rooms were so different. Yes, because in a normal room you have the patient has their own bathroom, and you kind of have more space to work. For them, at least the hospital I went to, there's 3 different units of units for the emergency room, and there were some rooms where it could be more intensive care, and there were some rooms where were super small, just meant to kind of get you in and out, and it was just a little different. You had less room to set down and stuff. There wasn't really anywhere to set your medications, and it was kind of just really fast. Yeah, so the thing I did really like about it though is that there was a doctor on the floor, which I actually really enjoyed, because I felt being on a med-surg floor, the way we contact the hospitalists or PAs or NPs is by paging them, and then they'd come up or they get a medication order changed, or maybe they're doing from oral to IV if they can't swallow, so stuff like that, and you don't really get to see them very often. And so I liked having the doctor on the floor. That way you could be hey, this person's troponin level was blah blah blah, would you like to order something like that. So it's way more faster communication, I would say, and I just like that. I thought that was a really, obviously you don't need them on like a med surg floor like 24/7, so I understand that, but I really like that aspect of having a doctor there. I thought that was really cool. Even the nurses station was like way smaller. You know what I mean? Like there's like a couple computers up there and that's really it. Yeah, it was like, there wasn't like clear, like, all this, like, because you go into a room and like they have like a lockbox in there with, like IV start kits, and there's fluids in the bottom. So like that was kind of cool because it makes sense of not having like one big med room for like just general stuff like that you need right away, like an IV start, like the needle and everything. That way, like if patient comes in, you have it right there, obviously locked. And the nurse, you have the password. So I really like that aspect, and it was just very fast paced, which I knew it would be, but I mean, it was like bam, 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 bam. Like, I got to put in some IVs, which were cool. I got to put in 2, like, antecubital, which is like the big vein right in the crook of your elbow. So it's a really easy one. It's a big, juicy, vein to put your IV. So that was fun. I liked that. And, yeah, like, it was just very fast paced. Like the thing that like I really like saw is like I did 0 time to like get to know my patients. Like basically like, how's your pain? How's their oxygen? Like all these like, like, oh, they need a bolus. Oh, they need this. Oh, let's get, something hung up for them. So you didn't get that time to kind of like get to know your patients, which I really love. Because I kind of like to, which obviously they don't have the time. It's not like I'm like, oh my gosh, ER nurses, like, obviously they don't have the time. Like, they're going bam, bam, bam. They're trying to get people stabilized to either go home or be admitted. But that's something, like, for me personally, I was like, maybe this isn't for me. You know what I mean? And I walked into the ER knowing, like, probably won't be my thing. But I wanted to give, like, I was excited to see it. I think as a nursing student, you're going to have ER admissions, all the time. So it's good to see like what's happening before they actually get to your floor, which I thought was a very good experience. Like the preceptor I worked with was very knowledgeable and great at what he did, and the nurses down there were great, and like it was very cool. They're all like very supportive, like if they had like a partial trauma coming in, like they'd announce it over the speaker so everyone could hear, and then like asking if anyone needs help with the trauma. So it was just a very team effort, and I really liked that aspect. Yeah, it was a very cool experience. I'm very lucky to have it. I can now say, like, I've been to an ER, like in a nursing role, so that was very cool. Yeah, like, the patients, like, we get, like, in, and then, like, once they're good, everything's stabilized, and, like, they're all set, discharge them home, or some got admitted. So that aspect was pretty cool, I thought. I thought it was difficult, especially for this ER, because this hospital doesn't have a mental health floor. So when, like, mental health patients come in, for example, for, like, a suicide precautions, it's really, like, difficult because they have to, like, hold them there until a bed opens up at a different hospital for a mental health floor. So I thought that was a little difficult. So yeah, it was pretty busy. It was fast paced. Like at the end, I was like, whoa. You know what I mean? Like, I think, if people want to be ER nurses, they have to be like very like, let's go. But it was a cool experience. I can definitely see why people would like it. It's very fast paced. It's very like doing stuff quick. It's unpredictable. You have no idea what's coming in. Like kind of, at least if you don't have a new admission, like on my floor, I get a report from the nurse previously, like kind of telling me what's going on. But for most of these stuff, like people are coming in, you kind of like learn from the triage, like what's going on, like are they having chest pain? Are they this happening? So that kind of thing. But yeah, I really liked it. I thought it was really cool. Would I consider going into the ER? Probably not. I just don't think it was my thing. I think people would definitely learn a lot. I would just be kind of scared as a new grad that I wouldn't really get trained a ton. I would just be kind of thrown in. And yeah, but I did like it. I think it was cool. So if any of you are interested in the ER, I highly recommend, like if you can shadow someone, I think it's a great kind of thing to see, especially,
you know, because some nurses are like, oh, like, why didn't they do this in the ER? Like, they could have, you know, like, but they're so busy down there. You know what I mean? Like, it's so unpredictable down there. Like, it's a wonder they get, like, a ton of stuff done. So, go ER nurses. You guys are doing great. So, yeah, that's kind of my experience in the ER. I really enjoyed it. It was so cool. And, yeah, so I'll see you guys later. Bye.